I was a first-time mom trying to breastfeed and was having struggles with it latching, nipple pain, the nipples were bleeding. It became not possible anymore. So I was ready to quit. A lactation consultant recommended coming in here. And 5 days old, I cried and cried and cried, having her do that and seeing her potentially go through pain. She didn't cry, actually. And we got it done, and now 4 weeks later, we're exclusively breastfeeding. And so I would recommend, get over the mom fears and just give it a try. And the exercises weren't so bad either. He was in charge of those.
Well said. Dr. Kapoor's great.
Hi, this is James, and he's about 4 months old, and he was having some feeding issues. He was taking quite a bit of time to finish a bottle. Close to 45 minutes to an hour, and we had him evaluated, and he had a tongue and cheek and lip tie, and Dr. Kapoor released them all, and now about a month later he's doing a bottle between 5 to 6 ounces in about 25-30 minutes. There's less gas, there's less snorting, and we couldn't be happier.
So we started with physical therapy for the lip and tongue tie, and we did see some improvement, but we hit a brick wall. And even though she was still transferring milk, I was having a really difficult time with the pain. It was a lot of pain, and I didn't think I could continue breastfeeding. And so I wasn't sure how I felt about getting the revision. And once we did, after the first 24 hours, it was truly a night and day change. Zero pain, she's really comfortable at the breast, she's getting lots of milk and growing well, and I couldn't be happier with the decision we made.
This is Vincent. Ever since we got his lip and tongue tie the procedure, he's been gaining more weight. He no longer falls asleep when nursing. He doesn't make the clicky sound. He's way less tense. He's a lot stronger. So we've seen a huge improvement in everything. So we're really happy we came to Dr. Kapoor.
Hi, this is Arthur. He is 3 weeks old now. When he first was born, he was having issues latching, and breastfeeding was very hard. So he lost a lot of weight. He was very gassy, and it was hard to make him breastfeed at all. So we came to see Dr. Kapoor. She was able to check his tongue and lip tie and recommended Frenectomy. He did it 2 weeks ago, and after that breastfeeding has been much easier. He gained weight, and he's a very happy baby now with his belly full.
Experience with Dr. Kapoor, I was recommended through a lactation consultant when I gave birth in the hospital. He had a lip, tongue, and cheek tie, and he was getting super frustrated latching onto me, and so I wanted to breastfeed exclusively, and coming here has helped a lot, and he has improved tremendously. He latches on, and he's doing good. Has great progress.
So it's been really pleasure with me and with Dion, because we had a lot of problems with latching, and I myself had tongue tie as a child, and so I know how difficult it was for me for like pronunciation and all other issues. I still have some issues on my shoulder and all. So for my baby, I wanted to get him early as possible, and his experience with Dr. Kapoor was very good. Babies have a hard time with dentists, but it was very smooth sailing for us, and he's doing good. Our latch has gotten improved a lot. Exclusive nursing. Before we got the surgery, he was half bottle feeding and nursing together because we had problems with latching, but now he's just fine with latching exclusively, so that's great news.
Came to Dr. Kapoor because baby was not latching properly, and got referred by a lactation consultant to see Dr. Kapoor, and turns out he had a lip tie, tongue tie, and both cheek ties. He was spitting up a lot, crying when eating, falling asleep, hiccuping, gassy, everything. From the list of symptoms, he had it all. It was really difficult for me to go ahead and decide to do this, but I'm so happy that I did. We're a month out, and he is a happy kid, eats well, sleeps better. So I would do it 10 times again, honestly.
We had such a great experience with Dr. Kapoor. We brought our daughter right in when she was about 2 weeks old and had such a problem with breastfeeding, but after the very quick procedure, breastfeeding has greatly improved. And I just wish that we brought our first child here, because I went through a lot of breastfeeding pain with him, but if we had known Dr. Kapoor was here, we would have brought him, and I would have avoided all of that. So such a great experience. All the people who work here are so professional and so friendly, and yeah, totally would recommend.
Hi, this is Luke. He's 11 weeks old now. We were noticing symptoms on the bottle about probably week 5. He was leaking a lot of milk. He was crying, throwing his head back while he was feeding. It was really stressful, multiple times a day. We had his tongue tie diagnosed on day 1, but didn't really have symptoms until a couple weeks later. And then once we started noticing symptoms, we came in, had a consultation, and then did a session of PT beforehand to have him evaluated, tongue mobility, body work, did a couple days of exercises before the procedure, and then did 2 follow-up sessions of PT. And now, a month later, the symptoms are pretty much all resolved. Fewer hiccups, he feeds much smoother, it's not crying, not as gassy. We're just so happy with the results, and really happy, and I've always felt really comfortable talking with Dr. Kapoor. Felt like she was big on education and giving us all the resources that we needed to make the decision that was right for our family. And I'm really glad that we did it. So thank you, Dr. Kapoor.